Hello again, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me today for the first time ever on this podcast, you guys get to be a first, which is always good.
We love that.
We've got father and son doctors in here from Monument Health to talk about audiology, ear, nose, and throat. We've got Dr. Logan Bowen and Dr. Vaughan Bowen. Thank you both for coming in and doing this today, guys. I appreciate it.
Absolutely.
Happy to be here.
Now, how long have you guys been at Monument or with Monument?
So myself, I've been here about a year and a half, I'd say. I got my degree in May 2023, so still fresh out of school.
Pretty new, yeah.
Yep.
So how about you, Doctor?
I've been with Monument for 2 years.
All right.
Yeah.
Now, what you do, Logan, is it directly because of the profession that your dad went into? Is that where the interest came from?
There was a lot of interest from it. I was kind of jumping around what my career's going to be.
Yeah.
And shadowed some people. I didn't want to be on call, though, like him. So.
Right.
So I chose this career, still in the medical field. So.
Okay. And how about you? Where did you get interested in this? Why did you choose to do this?
Ear, nose, and throat?
Yeah.
Wow, it's so far back in time. I don't know if I can recall exactly.
Come on.
Yeah.
Going back in time.
Right.
The head, neck, anatomy is fascinating. You get to see all age groups. You know, not every surgical field you get to see all age groups from, newborns all the way to elderly individuals. So that's kind of one of the reasons why I did that.
I suppose it makes it more interesting. It makes the day always different. For
it's a variety
sure.
that comes in. So yeah, I really enjoy it.
Well, now what's the difference between an audiologist and an ear, nose, and throat?
Yeah, so audiologist, I'm not doing surgery. So
Okay.
that's a big thing. So I'm going to evaluate patients. I'm going to see what could be wrong with either their hearing, their balance. I work with cochlear implants, fitting devices. And if I see something concerning that could be a potential growth or a mass or an ear infection, that's when I send them over to ENT. If something gets too involved, it's nice I can just jump it over to ENT, and they're going to look more in depth about what could be causing their issues.
Sure.
So
you guys definitely have to. You guys work as a team. I mean, both of your departments are 100% a team.
Absolutely.
Yep.
Yeah.
Okay. So then once he says, "Look, this is a little more serious. I got to send you over here." That's where you take over, and you can you do surgeries as well. Then
Yes.
Okay.
Yes. And it goes both ways. If somebody comes in and they feel like they have ear fullness, and it doesn't add up, we send them over to them. They might have a hearing loss that is fairly sudden onset, which is kind of an urgent thing to take care of.
Right.
So we try to get them over to them to get a hearing test and see what it looks like and get them treated accordingly.
Well, before we jump into this specific topic that I wanted to get to today, can you give? And this is going to be a tough question, probably, but maybe not. Can you just give a general overview of how our ears work? Right? How just a basic. Hey, this is why you're hearing our voices right now on this podcast.
Well, it starts from the outside coming in. I mean, you've got the size of the ears, the shape of the ears themselves. Sound comes in and directs it towards the ear canal, goes down the ear canal. Once it reaches the eardrum, that eardrum actually amplifies the sound about 2.5 times. So it goes through the eardrum, through the ear bones, to the inner ear, and it amplifies that sound. So a relatively big eardrum down to a small stapes foot plate, that actually amplifies the sound.
Now, that's where we have the smallest bone in our body too, isn't it?
Yeah.
Is in the ear there?
Yes, yeah.
Okay. See, every once in a while I paid attention to the weird facts of stuff like this.
Yeah.
And of course I've had different audiologists on the podcast before, and crystals always seem to be mentioned. How important are those? That's always been amazing to me because it always seems so ethereal. Right?
Yeah, so crystals, you're talking about the calcium crystals
Right.
inside the balance organs. So those sit on a type of kind of gelatin material, and they stay put, and they tell you if you're moving left, right, up and down, just your basic orientation. Sometimes those can naturally fall into place, and that's when you can have things called BPPV, or benign paroxysmal positional vertigo. It's a lot to say. And that's where you'll have people say, when I lay down, the room just starts spinning. And that's usually what they say, your crystals are out of whack. You have to go get those moved. So,
It's, I guess, where the balance of our bodies comes from. It surprises me that it is in our ear. Evolutionary, why? Why is it in that part of our?
Well,
can you answer that?
It's a little more complex
Sure.
than that. It's your ears, that's part of it, but your eyes are part of it as well. The muscles in your neck and the nerve connections from your legs to your feet all the way up into your brain, it all interacts inside of the brain. So if any one of those gets out of whack, then your balance gets off. The ear itself is more, if that gets to be a problem, it's more of a spinning sensation, like vertigo. Vertigo is spinning.
Right.
So that's what happens with the inner ear itself. But all those things work in conjunction. They're all connected inside of the brain to keep you in balance.
Okay. Well, I know we're going to do a couple of podcasts with you guys while I've got you here. One of them is going to be, I do want to talk about vertigo more in depth on the next one. But this one, I guess the reason why I want to do this one first is because, well, it affects me. And so I guess if I have an issue with it. But Dr. Vaughan, you said also that you suffer from this. And it's tinnitus, right?
I like to call it tinnitus.
Tinnitus. Everyone calls it whatever they want. But
tinnitus why can't we decide on what to call this?
I know. It's all the same. Yeah.
Okay, really quick then, for people that lots of people have heard of this, they understand it, heard of it. Can you just kind of briefly explain what it is and kind of what generally causes it?
Well, tinnitus is just an abnormal sound that you can hear that typically no one else can hear in general. Typically more noticeable when it's quiet.
Yeah.
You're laying in bed at night, and it can occur down into even teenage years. Which is kind of amazing because they don't really notice it. They don't really talk about it. But if they sit down and they realize, okay, I do hear something there. So we see some teenagers that have it on occasion. Most of the time it's older individuals. I think I jokingly say you have time to sit and reflect a little bit on life because it's quiet, nice quiet space. Then you hear that sound. Sound actually is coming from inside of your head. I call it brain noise because that's basically what it is. Mm-hmm. That's that high-pitched humming sound that we talk about. So there's other kinds of tinnitus as well. There's, as you mentioned before, objective and subjective. That's the subjective we're talking about. Objective is something that someone else can potentially hear. Not all that common to hear something like that, but sometimes that does occur. But you can also get something called pulsatile tinnitus, and that basically is, as it sounds, it's a pulsation in your ear. A lot of different causes for that. That is a type of tinnitus we usually work up further, i.e. scanning, such as a CT angiogram to evaluate the blood vessels. Sometimes the veins can be exposed a little bit in the ear, and they'll hear that as well, and we'll put pressure on the neck. If it goes away, might be a venous problem. So there are different reasons for pulsatile tinnitus as well.
So this can really be, it's not just that, this annoying ringing in my ear. Obviously, it can go much deeper than that.
It can,
in certain situations. Yes. Is it always linked to hearing loss, or is it? I think you just kind of answered that.
Well, that's a great thing. I'd say it's a lot of times linked to hearing loss. It can be caused from noise exposure, aging, ototoxic drugs. But some people, you can have normal hearing and still get this ringing happening, almost that phantom sound that's still there.
Yeah, it's. I was going to say something. The teenagers that I mentioned, hearing's normal.
Right.
But the sound is there. And it can be caused by some medications like ibuprofen, NSAIDs, that can increase your risk of ringing in the ears. So there's some medications that contribute to this as well. But stress, the more stress you have, it can definitely correlate with that. And it tends to feed itself. If you lay at night and you're trying to get to sleep and you cannot fall asleep, you're stressed, cortisol levels go up, the ringing gets louder, makes you more stressed. So it tends to feed itself.
Right.
And so you try to calm your mind down and try to do things to distract your mind from hearing that sound.
Okay. Are there common misconceptions about tinnitus though, that a lot of people that you when people come in and you're like, oh no, that's just get off TikTok. That's not a thing. do you get some of that when people come in?
Oh, absolutely.
Yeah.
We both see this. We see people that they see something online that use some tinnitus relief ear drops or whatever, and anatomically it makes absolutely no sense whatsoever. So I tell people, don't waste your money. We used to think there were some supplements like ginkgo biloba was big for a while. Try that, and it turns out didn't do anything at all for tinnitus.
Really?
It's a waste of money. Really.
Yeah. You touched a little on this, but are there lifestyle factors or habits that can worsen tinnitus, that can make it worse?
Well, as mentioned, some medications.
Okay.
They're like the NSAIDs or the ibuprofen type medications for arthritis. That's a big one. There are diuretics. And the way I look at it is anything that affects the kidneys. So NSAIDs can affect the kidneys. Diuretics can affect the kidneys because they were developed around the same time in utero.
Really?
And so
Okay.
that is one thing to kind of think about. There's also people that need to get chemotherapy, and there's certain type of chemotherapeutic agents that can make your hearing go down. And when your hearing goes down with that, it replaces that with ringing. So there's some things there as well. Smoking plus minus, it's hard to really tell because so many people have ringing that smoke and some that don't smoke.
Yeah.
And so it's hard to tell if that's part of it as well. I think a big factor is anxiety and stress. If you can get people to kind of calm down a little bit, not easy because everybody's stressed all the time. So it's hard to get people to calm down.
It
really
is.
Yeah, easier said than done.
Yeah,
for sure.
of course. Can it be serious? Can it be something that when you go in to see either of you, you're like, well, oh boy, we got to look a little further to this because this is connected to something else. So can it be something? Should you? Let me put it this way: if you have it, should you talk to doctors about it?
Well, I would say there is some types of tinnitus that can be concerning. If it's a roaring sound, if it's asymmetrical, then definitely get your ears checked. I recommend anyone, when you go in for a yearly physical, get your eyes checked, come in a year, get your hearing checked. We'll talk to you about it to see if it is something concerning or if it could be just linked to hearing loss.
What I would add to that is if we have somebody that has a sudden onset, one-sided, loud roaring tinnitus, that usually means their hearing's down. Mm-hmm. And so we like to see those patients within a week or so because it's kind of an emergency because if your hearing drops suddenly, it needs to be addressed. And we get an audiogram, we see if it's different on one side. I just had a couple of them recently that it's fairly urgent. We try to treat those with high-dose steroids, sometimes even steroids in the middle ear to try to improve the hearing because the goal is to get that hearing back to some sort of improvement. Mm-hmm. If not complete resolution, at least some sort of improvement if we can. And we've had patients that come in like that and the hearing's gone. Mm-hmm. Hearing's gone. It's just on one side typically. But the goal is to improve it as much as you can. So I would say somebody who has sudden onset, one-sided, loud roaring tinnitus, I would come in. And the other thing is if they have pulsatile tinnitus, I think that should be evaluated as well.
Well, and you were saying there's a really fine window about if you have a sudden hearing loss to come in. As a lot of people, you have a sore arm, something you said, I'll just wait. It'll get better on its own. With this situation, you really have to come in because if you wait 2-3 months, it could be too late to get that treatment to regain that hearing, and you may be stuck with a permanent hearing loss. So it's pretty urgent to come in.
And from what I understand about that, when it comes to hearing loss too, are there? Again, I'm trying to remember back to all of my classes, learning about stuff a little bit. You have the hairs in your ears, right? Mm. And what I've remembered that stood out to me is once those are gone, they're gone. They can't be replaced. Correct?
Correct.
Yep.
So that directly correlates then to hearing loss. So when you're saying to come in right away, why is that so important? What can you do in that moment to bring it back?
Yeah, so I'll pass it over to the ENT because he does the treatment.
The earlier you see them, the better chance of some sort of intervention. And so cutoff is typically around 30 days or so. If they tell me it's been 6 weeks, sometimes we can do something. If it's been 2 months, I say it's probably not worth doing anything at all. And we give it's basically high-dose steroids because we think there may be some inflammatory reaction in the inner ear. So steroids might help decrease that inflammation. We may or may not get anything back at all, but my thought is, so when they come in, at least try something.
Right.
If we're in that time frame.
Is it ever get connected to anything outside of hearing loss?
What's that? The
tinnitus. I mean, is it ever a symptom of something beyond hearing loss? Or is it generally just affecting your hearing?
There's not always hearing loss associated with tinnitus. And sometimes it's hard to really figure out.
Really?
If somebody comes in, they have pretty normal hearing, but they have ringing, it's hard to treat. Sometimes a brief course of steroids can be used, but typically it's hard. There's not much to do.
Okay.
There's another big thing is anyone even having diabetes, it can affect hearing loss and cause ringing. Because anything that could affect blood flow at all, the system there, it's so small, and any changes in blood flow can cause a slight damage to the system, which may not cause hearing loss, but it could cause some impaction or impairment in there, which could lead to that just that that
That's
loud
right.
sound. So,
Well, and you mentioned if it's specifically in one ear, that's where you're a little bit more concerned. And me, for example, I do have it in both, but every once in a while you get that. Just it peaks. It's like somebody turns up just a little bit of a distortion noise on a on a monitor or something, and then it goes away. And it'll happen maybe a couple times throughout the day, but it'll happen in both ears. That's I guess a quote unquote good sign if it's in there like that.
Yeah, absolutely. Yeah.
Okay.
And the more we talk about it, the louder mine is getting, and yours is as well.
Yes,
I'm guessing.
yes, absolutely,
So
especially my left ear.
There's definitely that component as well. The more you think about it, the louder it gets. And the less you think about it, the less it becomes. And
That's so true.
You have to try to ignore it as much as possible. And therapy is not that great, but there has been some studies demonstrating what's called cognitive behavioral therapy, and it's more with more of like the psychology of try to calm your mind down as much as possible. We don't have anybody around here that I know of that does that, but there are some online sources that can work through that, and that has been beneficial.
Okay.
See, I would say it doesn't really get rid of the tinnitus, but it's learning how to get your mind away from it.
Just to kind of, because there's, like you guys have said, there's really nothing we can do about it at this point, right? What do you guys see advancements coming down the pike that might be helping? Do you guys have anything encouraging or things you see that might?
There are tinnitus maskers out there that are like hearing aids that he can talk about as well.
Yeah.
And if somebody has hearing loss, if you need hearing aids, put hearing aids in, you can build in the tinnitus masker, and you can also just the hearing aid alone will increase the external sound coming in, and it'll decrease the sound you hear in your brain.
Oh,
So there's some utility with somebody with hearing loss. And a hearing aid, but if they have normal hearing, you could get a tinnitus masker, which is like a hearing aid. It just you can describe it a little better.
Well, tinnitus maskers, there's a lot of ways you can have it. It can be any hearing aid, but it can also just be a standalone device. You know those devices that people use to put their babies to sleep?
yes, exactly.
Same thing.
That's
you can
what it is.
Pick one of those up. I mean, a lot of people with tinnitus, they'll say, I need a fan running, I need a TV running.
Yes.
So by just bringing in the extra sound, it can help cover it up. So I always recommend play the noise just barely louder than your tinnitus and find a noise that's calming, whether it's ocean sounds or just waves going around, and that can help as well.
Yeah, we use that. We have just like an air purifier that sits in the room, and it is just the perfect noise to kind of block that out of there.
Absolutely.
Really quick before we wrap this one up, though, I do want to go back a little bit to that subjective and objective forms of tinnitus, because when I saw that objective that we talked about, that some people can actually hear other people's tinnitus. I mean, with instruments, I'm assuming, right?
Right.
I can't stand next to you, Dr. Vaughan, and be, well, I hear your tinnitus now.
No.
You should really fix that. That just blew me away that somebody else could hear it. What is happening with that type of tinnitus that it can come out like that? That can be heard.
More often than not, that will be in the pulsatile tinnitus. And I've had patients that have had like a carotid bruit in their neck they didn't know they had. And they hear this swish, swish in their ear, you listen to their neck, and there it is. Mm-hmm. So that is definitely something we can hear.
Right.
Well, even a globus tumor.
Yeah, there are some tumors you can get that are vascular tumors in your neck. You can get one on the tympanic membrane or eardrum, and those they're vascular, and they hear that sound in there as well.
And you can see it moving. If you look in there with otoscope, you can just see it pulsating.
So that can detect some other serious issues then, in a sense.
Yes, and the other thing we worry about is just rare do you get something like an aneurysm or intracranial aneurysm, things like that. That's why we do these studies to rule out the scary things, really. And not infrequently they're normal, but sometimes you'll see some artery or venous abnormality that needs to be addressed.
Okay. I've read that it can come across as that whine that you can hear in your ear, the rushing that you can hear, and in rare occasions people hear music. That's part of this as well.
That may be a different animal altogether. I don't. If they're actually hearing music itself, then some other cognitive thing is going on. I mean, if it's truly sounds like music. then they need to be evaluated for something else.
Okay.
What about typewriter's tinnitus? I've heard of that a few times.
Oh,
where
what's
people
that?
say it sounds like someone's typing on a typewriter.
I'm not
Have you
sure
heard of
what that is. No.
I've had a few patients
What's a
come in and mention
typewriter?
it. So, yeah, old school typewriter. They just get a clicking noise. So, tinnitus can present in many ways. You have the buzzing, hissing, humming. In some people, either
Right.
it's music or it's like a typewriter.
Sure.
So,
Well, like I just imagine you going into that objective and you're like, "Well, this is a great song." As you're
right, yeah.
start recording it,
right,
right?
exactly.
There are along the same lines. There are little muscles in the ear that will spasm, and that will give you a clicking in the ear as well.
Talking about
Okay.
stapedius.
Yeah, the stapedius muscle is one, and so if you ever had your eye twitch when you're
Yeah.
tired, it's a similar process in the middle ear. So that'll give you a clicking sound as well. So there's a lot of different things that can be all encompassing with tinnitus.
Is it really something that almost everybody's going to experience at some point?
Tinnitus in general?
Yeah.
It's quite prolific. I mean, it really is, and it's.
Yeah, a few studies I came across is they say about 50% of people with a hearing loss will experience tinnitus.
Okay.
The numbers could be a lot greater because most people don't go see someone, so it's not documented.
Right.
So I would say majority of people will experience it at some point in their life. So
But just experiencing it doesn't necessarily mean hearing loss.
No.
correct.
Okay, good. So yeah, I guess put up with it, and if it gets too serious, make sure you go see Dr. Logan for sure.
Absolutely,
And then hopefully we don't have to see you, Dr. Vaughan,
Yeah,
because
nothing
everything. Right, nothing. Of course, nothing personal at all. You're just that last line of defense. Glad you're there, obviously. But yeah, you said something that it's just great advice. You get your eyes checked. You go in yearly for your physicals. Get your ears,
checked.
get your hearing checked too. There's no reason not to.
Well, and if you do need someone who needs hearing aids, you want to get on it early because your brain has a pathway for hearing. If you wait too long, it's going to take a long time to rebuild that pathway, and hearing aids can be difficult. So get your ears checked. Consider hearing aids if it's an option. You can come and talk to us. We don't charge you
Right.
just to talk about options. We're here to educate you. So yeah, reach out, get your ears checked, and see where you're at.
Well, that's probably the best advice right there. That's I don't think a lot of people know that. The longer you wait, the worse it can be for hearing. Because again, when it goes, it goes. I don't think we've really figured out a way to bring it back completely.
Yeah, they're trying.
Exactly.
studies, yeah.
It's got to be exciting though too. That you think someday that will happen. That if somebody's like totally deaf, we might be able to completely restore
Oh,
that.
absolutely.
Yeah. Really?
Yeah, there'll be intracranial implants, in your
Yeah.
brain. I think it'll be even more advanced than the cochlear implants.
There's a lot of universities that are trying to regrow hair cells, and they're doing it on some animal species. They're seeing some success, but however, you have to find a way to administer the drug without taking the cochlea out.
Oh.
And so that's a way to find a way to
I think it'll be
deliver it.
there. I do. Yeah, who knows how long.
Yeah, that's exciting.
Yeah.
That's exciting. Well, Dr. Logan Bowen, Dr. Vaughan Bowen, thank you both for coming in and talking about this. I really appreciate it.
Happy to.
And it's helped me out. I'm going to turn the air purifier up just a little louder
There you
tonight,
go.
honestly. So
Smart move, yeah.
thank you guys very
All
much.
right,
I appreciate it.
Thank you.
Yeah, thanks.